Join us in our discussions on common pediatric dental topics.
So lately I find that a lot of parents are wondering why we are suggesting x-rays, and especially when their kids are only 3 or 4 years old. Do you find that's come up for you a lot too?
All the time.
So very often what I do is I explain to them first that there's different types of x-rays. First being the ones that go inside the mouth, like bite wings, which are in the back for the back teeth. We take periapicals, which are for closer up views of back or front teeth, and something called an occlusal, which is for the front teeth specifically. There's also the panoramic x-ray, the one that goes around the head, and that gives us a bigger, broader view of what we are looking at.
So to get into specifics, all the x-rays that we take here are digital x-rays, so they're lower radiation, but also the benefit that you guys get a copy of it so they can share with the other providers. Now this is just what it looks like for a bite wing. It looks quite big, but it's actually a lot smaller than the typical x-ray size that you find at your dentist. And what they do is they have the kids bite on. So one thing I do want to emphasize is that it's not really the age of the patient, but when the x-rays are actually indicated. So when the teeth are naturally straight or spaced, we don't need to have x-rays in order to diagnose what we call interproximal decay or cavities between the teeth. However, when they do start touching, it's impossible for any clinician to see if there's a cavity or not between the teeth, especially when they're really small. And unfortunately, when we do start seeing a cavity in the mouth clinically, that's already when it's a little bit bigger or a little too late. So oftentimes these x-rays are really, really important for that. For the front x-rays, they simply bite on it and we tell the kids it's like biting into a cookie. And the back ones, I would say ourselves and our hygienist assistants have great ways of making it easier for them because it's not comfortable for anyone. So I always tell parents, we tell them the indication, why it's important.
That's right.
And then that way they can make an informed decision and understand why x-rays are important.